Hey everybody, welcome to Vet Talks. Let's pause for a minute. This is Dr. Shadi Arafat, surgeon at TrueCare for Pets, Studio City, Los Angeles, California. Today we're going to talk about a topic that came up called Chiari-Like malformation. This is a neurologic disorder that we see in dogs, and perhaps some of you have heard of it before in people with Chiari malformation. Others probably heard of it through their own pets being affected by it, and to most I think this will be something completely new to you. So this is Chiari-Like malformation. Some veterinarians do call it Chiari malformation, but technically it's not identical to the human analog. The condition also is not to be confused with Budd-Chiari malformation or Budd-Chiari disease or syndrome or whatever. That's a completely different disorder. So Chiari-Like malformation is a neurologic disorder that we see in dogs, and most especially the Cavalier King Charles Spaniel. They are by far number one, the most common breed. There are other breeds that I've seen it in, mostly small breed dogs, the occasional very rare large breed dog, but usually it's a Cavalier King Charles problem. And if you were to screen these dogs as early as 6 months of age, you'll see it in the majority of the dogs, despite the best breeders out there. And so it's one of those conditions that's still very deeply rooted in the genetics, the biology of the breed. And so I would probably say, if you want to look for more information on Chiari-Like malformation, before I get into it myself, check out Long Island Veterinary Specialist website, livs.org, livs.org. Dr. Dominic Marino is probably, I would consider, world-renowned for this condition in dogs. He is, in my opinion, leading the research on it, along with Dr. Catherine Lowen, as well as Dr. Curtis Dewey, both amazing surgeons that kind of lead the research on this disease. So I would highly recommend that website if you want more information. And it's also these are also the doctors that taught me about Chiari-Like malformation. So Chiari-Like malformation in dogs is a disorder that usually they would consider they're born with it. And there's a defect in the back of the skull, the occipital bone. That defect pushes on the brain, and specifically the cerebellum, or the beginning part of the spinal cord, C1, or a combination of the two structures. And because of that compression, it, as you can imagine, of course, causes pain as one of the many symptoms. If you imagine a garden hose, so you have a garden hose and it's on, the water is flowing nicely. Well, the spinal cord and the brain are surrounded by cerebrospinal fluid basically, CSF. And the CSF under normal circumstances is flowing nicely, like a garden hose. If you imagine a divot on the spinal cord of the brain, kind of like this malformation in the back of the skull, it puts pressure on the neurovascular structures, and all of a sudden the nice flowing spinal fluid that coats the spinal cord and brain starts to become very erratic. It's kind of like putting your finger over a garden hose. All of a sudden the nice stream turns into this big splattering of water. And that's, among other theories, a simplistic explanation of what happens with these dogs. So you have a malformation that they're born with, a divot in the back of their skull that's causing pain by compressing the neurovascular structures, as well as now spinal fluid that is flowing in a turbulent manner. And so what this does is a combination of things. One theory, amongst many of course, is that this turbulent fluid then produces cavities in the spinal cord, literally like cavitations along the spinal canal. And not just the spinal cord and the neck where the malformation is, but actually it can happen in different areas, multifocally throughout the spinal cord. And there are of course certain patterns that we're identifying through research as far as what part of the spinal cord becomes affected with these cavitations. These cavitations are called syrinxes, or more specifically syringomalia or syringohydromalia, depending on who you talk to and how you define these terms. But syrinxes are in the breeding community of Cavalier King Charles Spaniels, it's called syringomalia or SM. And SM we see very commonly in this breed of dogs, or any dog that's affected with Chiari-Like malformation. What's interesting about this disease is the variation that it shows in such dogs. So the signs that you notice in these pets are all over the place. Most commonly, you're looking for dogs that have some kind of head pain or neck pain. A lot of times these dogs will be scratching either at the ear or the neck or the belly wall, the abdominal wall, and sometimes they don't even make contact with their feet. They're just scratching, but they're scratching in the air. You have others that will have vestibular disease or vertigo where they're off balance. You have some that will actually have seizures. Some have behavior abnormalities or blindness. And there's a variety of other signs that are kind of more nebulous, like not wanting to eat or not feeling appropriate, lethargic, what have you. But most commonly looking for those variation of neurologic signs. Most often you have neck pain and air scratching is the most common. It could affect breeds of any Cavalier King Charles Spaniels of any age. Most of the time, I think, in my experience at least, we usually see it could be younger to middle age, or occasionally very old, like in the teens, that can be affected by it for the first time. And just because you diagnose it in a 6-month-old Cavalier King Charles doesn't necessarily mean they show signs. In fact, most pets are not showing signs until later on. And because of the variation, so the compression in the back of the skull could be, the severity of that compression is highly variable. Whether or not they have SM is highly variable. Whether or not they have concurrent neurologic diseases that may or may not be related. So if they have fluid or mucus buildup in their inner ear, or if they have disc herniations in the neck or the lower back, these are things that are probably not related to Chiari-Like malformation SM, but they're very prevalent in Cavalier King Charles Spaniels. And so whether or not there's an association there, we don't really know. Dr. Marino and his team at Long Island Veterinary Specialists are leading the research on this. And so I think we're going to see, as time goes on, more and more publications that are trying to define these very specific parameters. So you're looking for a Cavalier King Charles Spaniel that is somewhere in the younger to middle age group, usually, that's showing a variety of neurologic signs, most commonly neck pain or scratching. And so because of this, the question then becomes, well, how do you diagnose it and what do you do about it? So the first hint in diagnosing is, of course, you've got the breed, the age, and what the signs are. But to actually confirm a diagnosis, because there are other neurologic conditions that we just mentioned that can cause these signs, you need an MRI. And you need an MRI that can basically scan the entire pet from nose to tail. You want to identify not only the brain abnormality, but also want to identify SM in these dogs, as well as any other concurrent related or unrelated neurologic conditions. And the MRI is your best course of action to take. Other imaging modalities like X-rays or CAT scan just aren't going to cut it. You really need to perform an MRI. And so facilities like Long Island Veterinary Specialists, and hopefully very soon TrueCare for Pets in Studio City, Los Angeles, my own hospital, will be able to have an MRI and be able to perform these tests on dogs with these types of neurologic conditions. So once you perform the MRI, the question then becomes, what do you do? And that's a very complex question, because there's even dispute among surgeons and neurologists as far as what the best way to treat these pets. I've seen very positive, very encouraging results under the surgeons in New York and Long Island with surgery. Seems to be very, over time, as the procedure has become more tweaked, we're seeing outcomes that are much better and better, and it drastically improves the quality of life for these pets. So the question is, do you treat dogs that don't have signs of this disease? Like, let's say you just happen to screen your Cavalier King Charles because you're a breeder, or because you want to adopt a dog, or you just want to be proactive. If the patient is not showing signs, do you treat them? If they're showing signs but they're mild, do you treat them? If the MRI is showing severe signs of disease but your pet actually isn't showing any pathology, do you treat them? And then, of course, does the age matter? Should you treat them while they're young versus when they're older? And these are all questions that you have to have with the specialist, because it really depends on what you want to do as a person, where you're at, not only emotionally but financially, and of course what kind of quality of life is your pet experiencing. So the treatment options are going to be divided into two different camps: medical management and surgical options. The medications are going to be focused on anti-inflammatories, trying to control the CSF flow, the spinal fluid, trying to control the pain associated with this condition, and that's going to be the mainstay of the therapy, including things that are more conservative, like don't use neck leads anymore. You can use a body harness, try and keep them restricted activity for a while if they're showing acute signs. If they have any concurrent neurologic disorders, those might need different therapies, whether medication or surgery, it depends on the case. But usually it's a combination of different medications for some period of time, could be weeks, months, could be lifelong depending on the pet. If your pet has seizures, then you may be using anti-seizure medications on top of the medications I just mentioned. So there's a variety of different medications you could use that are tailored towards your pet and the MRI images and what you want to do. Then there's surgical route. The surgical route implies some variation from surgeon to surgeon, but the one that I have most experience with, Dr. Marino and Dr. Dewey and Dr. Lowen at Long Island Veterinary Specialists, is called a foramen magnum decompression. And so what we're trying to do in a cranioplasty. So what you're trying to do is you're trying to remove, of course, the divot in the back of the neck. That's obvious. You remove that portion of the skull and you make the opening of the skull where the spinal cord leaves the brain larger. That's a foramen magnum. And so the foramen magnum decompression is you open up that area, you get rid of that divot they have in the back of the skull, and then you can either leave it there, but you risk scar tissue formation on the area. If you want to prevent scar tissue formation, then you do what's called a cranioplasty. And so we actually have developed a mesh-like substance that you actually form to the back of the skull and built into the back of the skull with very, very tiny screws, and that'll hopefully, it's almost shaped like a Pringle chip, and that hopefully will prevent any level of scar tissue formation long term. The outcome with surgery can be variable, depends on the age of the patient, what their signs are, how well surgery goes, what other abnormalities do they have going on at the same time. And that, again, is a very specific conversation that you should have in depth with the surgeon that's going to be performing the surgery. There are different levels of surgical intervention, and there are very, very many different opinions on this topic. So by no means am I advocating one or the other, but in my own experience, I've been very happy overall with the overall success rate of surgical intervention. Some pets do very well with surgery alone. Some pets need medications with surgery. Some pets do very well with just medications. And just like the disease being highly variable, the response to therapy is also highly variable. The prognosis depends on all these things. So if you have a dog that's maybe older, that's showing multiple neurologic disease and probably needs surgery, but you're worried about the age and recovery, or the surgeon is worried about it, the prognosis may not be as good as a younger dog that you diagnose before they start showing severe signs. And if they're younger, they undergo surgery and the surgery goes really well, they have no other abnormalities, well, then you're hoping that the surgery will be as close to curative as possible. Understanding, of course, like any other operation and any other neurologic disorder, there's always risks involved and complications that occur either in the short term or long term. This is still one of those diseases that's very complex. We have a lot to understand about it, and there's still a very much difference in opinions between specialists as far as how to treat these patients, when to recommend surgery, when to recommend medication, and so there's a lot to talk about there. But I hope this helps give you a brief recap on Chiari-Like malformation, specifically in the Cavalier King Charles Spaniel. Go ahead and check out livs.org for more information. Let me know if you have any questions or any other topics related to this, or any other topics you want me to talk about on this channel. This is Dr. Chiari-Like, surgeon at TrueCare for Pets, Studio City, Los Angeles. Vet Talks, let's pause for a minute. Thank you so much, and we'll see you in the next video.